The Sustainable Development Goals, or SDGs, also known as the Global Goals, were adopted by the United Nations in 2015 as an universal call to action to end poverty, protect the planet, and ensure that by 2030 all people enjoy peace, prosperity, and eventually achieve a better and more sustainable future for all of us. Of the 17 aspects raised in the SDGs, we choose the theme of health and well-being to apply in our work programs. One of its goals, the good health and well-being goal, now becomes more important than ever, amidst or because of the global coronavirus pandemic. The COVID-19 pandemic has changed the way we live. Not only has it led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health, but also caused massive economic and social disruption that led millions of people at risk of falling into extreme poverty. To end this, save more life, and bring all life back to normal, it will take a monumental effort and resources that can be done by the government and medical workers alone. They need our help. That's why we chose this program, to encourage more people to stand and help our fight to end this pandemic together. Before we explain how you can help our fight to end this pandemic, let's learn more about the coronavirus pandemic. Coronavirus disease 2019 or COVID-19 is a contagious disease caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. The first known case was identified in Wuhan, China in December 2019. The disease has since then spread worldwide, leading to an ongoing pandemic. As of now, researchers know that the coronavirus is mainly spread through droplets and virus particles released into the air when an infected person breathes, talks, laughs, sings, coughs, or sneezes. Larger droplets may fall to the ground in a few seconds, but tiny infectious particles can linger in the air and accumulate in indoor places, especially where many people are gathered and there is poor ventilation. This is why mask wearing, eye hygiene, and physical distancing are essential in preventing COVID-19. Some people infected by COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms show up in people within 2 to 14 days of exposure to the virus. A person infected with the coronavirus is contagious to others for up to 2 days before symptoms appear, and they remain contagious to others for 10 to 20 days, depending upon their immune system and the severity of their illness. Anyone can have mild to severe symptoms. People with these symptoms may have COVID-19, fever or chills, cough, shortness of breath or difficulty in breathing, fatigue, muscular or body ache, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. In some cases, however, COVID-19 can lead to respiratory failure, lasting lung and heart muscle damage, nervous system problems, kidney failure, or death. Some of these symptoms are similar to the flu or influenza or the common cold, which are a lot more common than novel coronavirus. This is why testing is required to confirm if someone has novel coronavirus. Besides the vaccination, there are other ways to prevent this. 1. Always wear a mask when going outside. 2. Wash your hands regularly. 3. Keep your distance from others. 4. Avoid crowds and crowded places. And 5. Minimize your outdoor activities and stay at home. After we know some information about COVID-19 and how to prevent it, we decided to make COVID prevention one of our top programs to help fight this pandemic, which in this program is explaining the government's 5M program, which includes the previously mentioned points and also explaining about the COVID-19 to the public. In the end, the purpose of our program is to inform the public on how to properly implement the 5M program, explain COVID-19 to the public, and eventually encourage them to join our fight in stopping this pandemic. In the government's 5M program, there are 5 points of how to prevent COVID-19. That is, wear a mask, wash your hands, keep your distance, avoid crowds, and minimize your outdoor activities. Now I will explain these 5 points one by one. 1. Wear a mask. COVID-19 spreads mainly from person to person through respiratory droplets. Respiratory droplets travel into the air when you cough, sneeze, talk, or shout. These droplets can then land in the mouth or noses of people who are near you, or they may breathe these droplets in. Masks are a simple barrier to help prevent your respiratory droplets from reaching others. Several studies show that masks reduce the spread of droplets when worn over the nose and mouth. In short, wearing a mask not only saves yourself from this disease, but other people too. So, what are you waiting for? Wear a mask when you go outside. Here is some guidelines on how to properly wear a face mask. 1. Wash your hand before and after touching the mask. 2. Touch only the hands or thighs when putting on and taking off your mask. 3. Make sure the mask fits to cover your nose, mouth, and chin. And 4. Make sure you can breathe and talk comfortably through your mask. If you want to adjust your mask, wash your hands before and after touching it. 2. Wash your hands. It's important to make a habit to wash your hands, because germs and viruses are very easy to transmit by hand. Therefore, washing your hands with soap can clean it from germs and viruses. Here's how to wash your hands properly. 1. Wet both palms with water, then spread the soap on both palms. 2. Rub the palms of the hands and between the fingers at the same time. 3. Rub the back of the fingers with the position of the hands interlocked. 4. Rub thumbs and twist for both hands. 5. Rub the fingers on the palm alternatively. 6. Rub both wrists in a circular motion. And 7. Rinse with running water and dry with a tissue. 3. Keep your distance. The reason as to why you should keep your distance from others to prevent COVID-19 is because social distancing will put space between individuals. If someone is sick and there are no people around, a virus cannot spread, so you will avoid the risk of being exposed to COVID droplets from other people, and that will reduce your risk of getting COVID-19 from other people too. So, try to keep your distance at least 1 meter from other people. 4. Avoid crowds and crowded places. COVID-19 mainly spreads through airborne droplets from coughing and sneezing. In an area with large groups and small places, there will be no distance between person to person. Eventually, it will increase the chance of this virus to spread among the people in that area. So, do your best to avoid crowded places. However, if you can avoid this place, you can wear a double mask or face shield to minimize your risk. And lastly, 5. Stay at home. In many cases, people that got infected by COVID-19 didn't show any symptoms at all. It made this virus harder to recognize and easy to spread from person to person, because sometimes people that got infected did not know that they got infected by COVID-19. So, the best way to reduce your risk is to stay at home and limit your outdoor activities. If you can, try your best to follow the 4 rules that I have explained before.